Before you start using Humira, CF, pen Crohn's UCHS injector kit, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, it's important to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using the medication, check it visually for particles or discoloration. If you see either of these, do not use the liquid. If you are taking the medication out of the refrigerator, let it sit at room temperature for 15 to 30 minutes before injecting. Do not warm up the medication in any other way, such as by heating it in the microwave or placing it in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject it under the skin on the thigh or abdomen as directed, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule or higher dose at the start of your treatment. Make sure to carefully follow your doctor's directions for using this medication. It's important to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts or gets worse, make sure to tell your doctor. If you experience redness, itching, pain, or swelling at the injection site, make sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of potential side effects. However, it's essential to watch out for signs of infection, such as a sore throat, persistent cough, fever, or trouble breathing, and seek medical attention if you notice any of these symptoms. Additionally, it's crucial to report any serious side effects to your doctor right away, such as changes in heart rate, symptoms of heart failure, blood in the stool, mental/mood changes, severe headache, or unexplained muscle weakness. In some rare cases, this medication may cause serious liver disease, so it's important to watch for symptoms like nausea, loss of appetite, stomach pain, or yellowing of the eyes and skin. If you experience a very serious allergic reaction, seek medical help immediately. Symptoms may include rash, swelling of the face or throat, severe dizziness, or trouble breathing. And remember, this is not a complete list of possible side effects, so always contact your doctor if you notice any other effects not listed here. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Humira, CF, pen Crohn's UCHS injector kit, it's important to inform your doctor or pharmacist if you have any allergies, especially to adalimumab or any of its components. This medication may contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your healthcare provider. It's also important to disclose your medical history to your doctor or pharmacist, especially if you have had recent or repeated infections, blood or bone marrow problems, seizures, certain brain or nerve disorders, cancer, heart disease, or lupus. Adalimumab can increase your risk of getting infections or worsening current infections, so it's important to avoid contact with anyone who has a contagious illness. You should also inform your healthcare professional if you have been exposed to an infection. Before receiving any immunizations or vaccinations, it's crucial to inform your healthcare provider that you are using adalimumab. It's also important to avoid contact with individuals who have recently received live vaccines. To reduce the risk of injury, use caution with sharp objects and avoid activities that may result in cuts or bruises. Additionally, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgical procedures. Older adults may be at a greater risk for infections and cancer while using this medication. Pregnant individuals should only use this medication when clearly needed, and breastfeeding individuals should consult their doctor before using this medication. It's important to be aware that Humira, CF, pen Crohn's UCHS injector kit may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Humira, CF, pen Crohn's UCHS injector kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns with your doctor. If someone has taken too much Humira, CF, pen Crohn's UCHS injector kit and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to act quickly in these situations to ensure the person gets the help they need. Remember, it's always better to be safe than sorry when it comes to medication overdose. It's important not to share this medication with others. While using this medication, it's important to have lab and/or medical tests done, such as a complete blood count and liver function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Humira, make sure to consult your doctor or pharmacist immediately to get a new dosing schedule. Do not take a double dose to make up for the missed one. It is important to store Humira, CF, pen Crohn's UCHS injector kit in the refrigerator, but do not freeze it. Some brands may be stored at room temperature, so check with your pharmacist or read the product package for specific instructions. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. Keep the medication in the original container to protect it from light, and discard any unused portion. Remember to keep all medications away from children and pets. When it comes to disposal, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.